Hi there, welcome to this week's podcast episode. This week I want to discuss the topic of anxiety, particularly anxiety when it comes to performing your procedures, whether that's actually when you're doing the procedure or after you've finished your procedure and you're awaiting the results or the review of your client. So I have talked about this before. If you look back in previous podcast episodes, a couple of years ago now, I did a podcast titled How to Overcome Nerves When Injecting. Now, the reason that I wanted to touch on this particular topic again this week is because I was actually contacted by two different students asking me how they can overcome this sense of dread and this sense of anxiety when injecting and whether it's a normal response. That coupled with also stumbling across a reel. So the reel was a comedy reel and it was made by a male Canadian injector, a nurse injector. It was basically showing how he felt when he came to inject his first few patients. So it was basically sweating, fear, heart racing, shaking. And it's not funny as in the sense that he was making fun of other people. He was actually shedding light and making fun of something that he had struggled with. So this did touch on me personally because I too did struggle with this issue for a long time. And when I looked at the reel, I obviously then looked down the comments and it was unbelievable the amount of medical injectors that actually struggled with the exact same thing. So in this reel, this male injector basically said that the way he overcame this fear so he could do his job effectively without any hassle or any distractions was by taking propanolol. And then the other injectors commented agreeing that they said propanolol had been their rescue and helped them get past this actual physical effect that fear can have when it takes hold. So for those listening that have no medical background, basically, propanolol is a beta blocker. And what a beta blocker does is it blocks the action of adrenaline. So it helps to keep the heart rate nice and steady, because when we're undergoing moments of fear or stress, what happens is the heart rate increases, adrenaline's secreted, and with that, we can experience a tightening of the chest, shortness of breath, the adrenaline response of shaking. So basically, propanolol stops all this action of adrenaline on the body. So that was the way that this particular injector and people in the comments had overcome this phobia, because it's actually a phobia that this problem creates. Now, I too struggled with this for a long time, and I was absolutely at my wit's end at one point because it was just so debilitating. And I too had periods where I used propanolol. But I'm quite a determined person, and every time I would use the beta blocker, it worked brilliantly. But I used to feel so angry and annoyed with myself. I used to think, I want to be able to do this naturally. I don't want to rely on this crutch of this medication to help get me through. So this is why I kind of wanted to touch on this topic today. So what I've come to learn now, 15 years on, is that nerves are completely normal, and nerves are in no way related to your level of competence and your level of ability. It's just that some people are more susceptible to the action of adrenaline on the body. And believe it or not, it's not the shaking that you can't stop that's keeping you stuck. What happens is when you go to inject, if you see that adrenaline response and you see that shaky hand, what that does then is it invokes emotion. And it's the emotion that's the strong component that the mind latches onto. So the emotion that's usually invoked is embarrassment, fear of judgment, fear of what will that person think if they can see that I'm nervous and I'm shaking when I come to do their treatment. Are they going to think that I'm not very good, that I'm incompetent, that I don't know what I'm doing? So it's all these things combined that basically set off this cascade of emotions, but also then get you into this phobia. It creates this phobia. And then what happens is you fixate on it and you think about it constantly. So you'll think about it before you come to do your next injection. You might think about it the night before. You'll think about it as you come in to do your injection. And again, this is a normal human response. It's almost like an animal response, because all your brain is trying to do is to keep you safe. It knows that this happened once before. It knows how you felt about that situation. It knows you didn't feel good about it. So your brain is trying to protect you and keep you safe from experiencing that situation again. So there's actually nothing wrong with you. You've got a very clever body and a clever mind and a clever brain that's basically just trying to keep you safe. But because the emotion that was invoked the first time that this happened was so strong, it imprints and it keeps you stuck in this loop. So the more that you focus on it, the bigger this issue becomes. And the more that you try not to focus on it, the more you obviously know, if somebody says to you, don't think of an elephant, you'll think of an elephant. The more that you try to not do something, the stronger it becomes. So you get kind of trapped in this kind of vicious cycle. So what you've got to do is actually interrupt that thought pattern, interrupt that loop. You're retraining your brain and creating new circuits, because that circuit's formed really quickly. You know, your mind and your body being in that situation knows the level of fear and the level of intensity that you felt, and it will do what it can to try and keep you from experiencing that situation again. So you can take a shortcut. Some people do choose propanolol. They choose to quickly block the action of adrenaline chemically on the body with the propanolol. But I encourage you to really get to the root cause of the issue and also naturally interrupt those thought patterns so that you don't have to become reliant on something like a beta blocker medication. So how do we approach this? How do we get past this? How do we alleviate this shaking, this fear, and this anxiety? So first and foremost, let's look at what's in the environment. Let's look if there's something that is genuinely making you feel uncomfortable. So for me, a big one was the way that I was taught to inject. So when I trained, we were all taught to inject Botox from the front, and I'm 5'2", and for me, I find this quite difficult. So if I was to inject the frown lining, the procerus, the glabella, I find it difficult to kind of reach over, I've no support for my arm or hand, and actually get the needle straight into the centre of the procerus. It just feels very unnatural to me. So I persisted trying to do it this way for absolutely ages. And then I just thought, why am I trying to do something that just naturally feels really uncomfortable? Logically, I thought to myself, well, as long as it's the right dose, the exact same dose as I would do from the front, as long as I can inject at the same depth, at the same angle, what does it matter? Why am I trying to make life difficult for myself by injecting in a way that feels uncomfortable? So how I perform all my Botox injections, and I would say I've done this now for a decade, is I actually perform my injections from the back of the bed. So my clients lay kind of semi-upright, but enough just so I can get around the back of my bed and I can position myself in a way that feels comfortable. So I know I'm still injecting frontalis, I'm still injecting glabella exactly the same way as I would if I was injecting from the front. For me, it feels more comfortable. It feels safer for the person that I'm injecting because I'm not unsupported coming near the eye area. I'm not saying the other way is wrong, but the other way just didn't feel right for me. So I've adapted that, and straight away that helped to kind of bring some of the fear down, because I'm from the back. The person that I'm injecting has their eyes closed, and it just feels nice and secure and nice and stable. So address anything that's going on kind of in your environment that can make life a little bit more easier for yourself. Obviously, a big one is first-time clients. So if you are new to aesthetics and it's a brand new client, then understandably, you're going to feel more anxiety than you would on somebody that's been coming several years, being happy with treatments that you've then built a nice relationship up with. So again, just let yourself know that that is completely normal until you get to know that particular client. Obviously, make sure that you've addressed expectations, make sure that you've done a thorough medical history form, a consultation form, you've kept everything safe to the best of your ability, and then you can always tell the person that you're injecting to close their eyes, just take some nice deep breaths, and you can talk to them as you inject. So as I've said, the more you try and resist something, the more it happens. So if you're going to inject and you tell yourself, oh, don't shake, don't shake, don't shake, don't shake, all this tension and all this fear is getting built up in the body. And guess what? Chances are you're going to shake. But if you kind of trick your mind into soften the body, relax the body, you could make sure that as you're about to inject, instead of focusing on don't shake, focus on the breath. So it could be big deep breath in, nice long breath out, trying to interrupt that loop and that thought pattern. It could be that you have music in the background that you can connect with that makes you feel comfortable as a form of kind of subconscious distraction. It could be that as you're about to inject, you use positive affirmations. So it could be something along the lines of, I am capable, I am confident, I've got this. Something that's just helping to interrupt that thought pattern rather than, don't shake, don't shake, don't shake. It's looking at ways that you can rewire the brain. Tension will always bring more tension. Also, you want to make sure that you're actually using up the excess adrenaline that you've got circulating in your body. So I can't reiterate enough about regular exercise. I like to resistance train. I like to do yoga because that helps to kind of diffuse tension out of the body. It also helps to switch on the relaxation response. Meditation, breathing techniques, positive visualization, that can all help. But to put it simply, the easiest thing is to just think, so what? So what if I shake? And I know that this works because in my training academy, the first thing I do is always address anxiety, nerves, and the risk of shaking. So I address it way before the live model comes in, who the student is going to inject. So I always say to them, anxiety is normal, nerves are normal, feeling jittery is normal, feeling a little bit shaky is normal. It doesn't matter. Nobody cares. It's nothing to fear. The person that you're injecting's got their eyes closed, and you should never feel embarrassed in front of me because I'm never going to pass any judgment. And as soon as I say that, you can see the student goes, and they take a breath out and they relax. And guess what? They don't shake when they come to do their injections because we've dispelled the fear. We've dispersed the fear around it. Nobody's worried about shaking, so nobody shakes. Now, it could be that you've had a negative experience. So this is what started mine off. So basically, when I trained, it's really bad actually looking back, but it is 15 years ago. So there were literally about 15 of us in this room in Manchester. None of us got our own models. We basically all shared the models. So there might have been 2 of us doing the glabella injections, 2 to 3 doing the eye injections. And I can remember at the time, I didn't actually feel that nervous. But as soon as somebody passed me the syringe and I went to do the Proceras, my hand was literally like this. But it shocked me because I thought, I didn't feel particularly nervous, but when I saw that, straight away, whoosh, the adrenaline went up, the embarrassment kicked in, the fear kicked in. There were so many people watching, and the first thing I thought was, they're going to think I'm incompetent. They're going to think I'm stupid. And it was all that negative self-talk. Again, if you remember, it's the emotion that's invoked that keeps you stuck. And I didn't have a particularly nice trainer. I'm not frightened to say that. It was a guy who just made me feel really, really stupid for that happening. And it was a big lesson learned because what I do is I learned from that experience, and I made a promise to every student that walks through the door that no way will my students who come through Timeless Training Academy ever feel that way. But again, my brain knew that I felt so uncomfortable in that situation. I literally at the time just wanted the ground to swallow me up, and I wanted to run. I wanted to get out of there. It was that classic fight or flight response, but I had to keep going. And at the time, I was just starting out. Every time I had a new booking for Botox, I always feared that particular injection the most. Even though it's one of the easiest injections, there's absolutely nothing to fear. It was because of the experience that I'd had. So that's how quickly loops are formed within the brain, but just as a way to keep you safe. So your job is to create new circuits and interrupt the loop that's being formed. And it doesn't always have to be to do with the injections, even just doing a new hobby, something that challenges you. I know at the time, years ago, I got into doing all the ice baths and things like that. And that really helped because you kind of training yourself to cope with stress. So by me exposing myself to the cold, it learned me how to cope in a situation that my body found stressful. It helped me kind of build up tolerance. It can be outside things that really help you to kind of build up resistance and build up confidence levels so that you can help to create these new loops and these new thought patterns. Some people do go down the alternative therapy route. So I know some people have had success with hypnotherapy. I tried that. Short time it worked, but it didn't work long term, although it could for some people. But just to demonstrate, to tell you how animalistic this response is, I have a little dog. She's a little cocker spaniel called Mabel. And last year it was bonfire night. We were out for a walk just around where the local houses are. It was dark. It was actually 2 nights before bonfire night, and all of a sudden lots of fireworks went off. And she was absolutely traumatized to the point where she wanted to race home. She was pulling me back. When she got in, she was hiding under the bed and in the wardrobe. And literally, it went on for months after. Every time, even though it wasn't bonfire night, there was no fireworks, every time she would get to a certain part on the estate where I live, she would literally, fear would kick in, she would panic, and she would want to bolt and go home. And it went on for months. So it just shows that it's the emotion that she felt when she heard those fireworks for the first time. Fear kicked in. She didn't know what was going on. She just wanted to get out of that situation. Fight or flight kicked in. But the brain doesn't know the difference between reality or imagination. So every time that she would literally go to that street, she wanted to come home as if the event was still happening because her mind was just trying to keep her safe. It knew how awful, how scary, and how uncomfortable she felt in that initial situation. And it just thought, right, keep you safe. Your brain is primed for survival. It's going to do what it can to get you out of that situation. And eventually it dispersed. So we interrupted the loop by throwing a ball when we were on a certain part of the estate, or giving her a treat, or walking a different way. And eventually the new thought patterns and the new loops took over. So that's actually a few little tips that I can offer to help when it comes to the physical effects that nerves can have on you when you're injecting. But I also want to talk about the way that you can feel anxious after you've done a treatment. So this is more related to the outcome of the treatment. You might have done a particular treatment and then you're feeling really nervous and really anxious about, are they going to like it? Are there going to be any problems? Are they going to look okay? And again, it's all related to fear of judgment and fear of what other people think, and perfectionist tendencies to try and meet other people's expectations. Perfectionism really is just fear of judgment sugar-coated in a way that makes you feel better by saying, I'm a perfectionist. And I know that as a self-reformed perfectionist, I didn't realise how much I feared judgment from other people and how much I cared about what other people thought. Now, I just have the attitude of, I have done the best I can, and I've worked with the products, and the products can only do what the products can do. I've injected it in a way that I know I should inject it, the way that I've been taught. I've injected in a way that's kept me safe and kept the person that I'm injecting safe. The rest of it is out of my hands. People's opinions are out of your hands. Expectations are out of your hands. And when you begin to kind of lessen the grip and lose being attached to the outcome, the easier it actually becomes. And, worst case scenario, should somebody really, really not like their treatment, it will always naturally wear off. But if it's something like dermal filler, as long as you use a hyaluronic acid dermal filler, the dermal filler can always be dissolved. If it's Botox and it's something they don't like, the Botox will wear off. We're not performing plastic surgery. We're not performing facelifts where the results are permanent. So it's trying to kind of Always just rationalize with yourself that you've just done the best that you can do. And I think this kind of anxiety related to outcome and will they like it, and it's always worse in the beginning. So it's worse when you're doing a new procedure, but worse when it's also a new client, because in the initial stages, everybody is a new client. But as you go further down the line, you begin to build a relationship up and rapport with different clients. So you know more about their expectations, you know more about what they're like as a person. So I think in the initial stages, that anxiety is doubled and it is worse because everybody's new that comes through the door. But I can't stress enough, I say this to everybody, you can only do what the product can do. And I think a lot of it about worrying about the outcome, whether they like it, is because you've attached yourself to that. Now, you wouldn't do that if you worked in the hospital. This is what I've said time and time again. In the hospital, you would go in and you would perform that procedure that you've been taught, but you wouldn't attach you and who you are as a person or what that patient might think about you to that procedure. And it might not feel like it because what you're doing is a paid service, but it's exactly the same. You're working with a product, you're working with a material, and you've been taught a certain way to do things. So really, what you're probably struggling more with is the whole exchange of money for services. And that's a topic for another time. But I hope this week that this has helped. It's only short. I know these podcasts are only short. Now, existing Academy members, Dawn and I are opening our membership soon, where we dive into a lot more topics and strategies in a lot more detail. The topics are just a real kind of general overview for other people that might be listening. I know that we have lots of digital online products coming as well, things that we can do to help people in other parts of the world. And as I've said, I know that people do struggle with different things all over the world. That reel I saw was Canadian. There was injectors from all over the world talking. So it's so common. Never ever think it's only you. We're all in this together and we're all here to help each other. That's the main thing. And I think we think sometimes it's only us that's been through something or struggling with something, when actually it's a normal, human, common experience. So short and sweet this week. If there's anything you need at all, please reach out and I shall see you next week.